What is up, my life-saving friends? It is your girl Shanice.Lashun, and we are back with another highly requested video. And when I say highly requested, I mean very highly requested. I'm talking about months, and your girl has just been slack, okay? So this video has been requested by numerous of people who are very interested in getting into the interventional radiology field. A lot of people don't even know that interventional radiology nursing exists. So I am very excited, very happy to be able to share this information with y'all. So y'all make sure that y'all stay tuned after the credits, because we're gonna get into the full details of what it is, how we get into it, how I got into it, like what do I do. You don't want to miss it. Stay tuned. Alright y'all, so while y'all were gone, I ended up inquiring a special guest who is minding her own business but in my way at the same time. So if she's in and out of the video, please ignore her. But if you tuned into this video, you know exactly what we're getting ready to talk about. I hope, if you are new to this channel, I hope that I answer everything that you want to know about interventional radiology. But if I don't, please do not be afraid to leave a comment down below. I will answer it as soon as I can. I know that there are a lot of things that a lot of people question or ask. So if I don't talk about it in this video, please, please, please drop a comment down below. And even if you are not even new to this channel, please leave a comment, because I answer everybody. I try to get back to everybody. I know that interventional radiology is something that's not really marketed to nurses a lot. So I'm going to do my best to explain to y'all exactly what it is that I do on a daily basis, what happens, how I got into it, how you can get into it. So let's get started, because this is a well overdue video. Like I said, like months overdue. So like probably a year overdue. So let's just get straight into it, okay? So the first thing that we're gonna talk about is, what is interventional radiology? So see what I mean? Okay, so what is interventional radiology? Pretty much interventional radiology is patients who require certain types of procedures that have to be done under fluoro. So when I say under fluoro, I mean like x-ray. You know how patients have to have x-rays and stuff like that. We use a specific type of live x-ray that shows us exactly what we're trying to get to when it comes to certain types of, or a specific type of part on the body that we have to get to for the patient. So we use what are called interventional radiologists, who have been trained, and I think they have to go through like 11 years of training or something like that to actually be able to do these procedures. So what they do is they use a live x-ray machine that's called fluoro that allows them to be able to navigate wires and catheters to a certain spot that the patient is having an issue in, whether it be a biopsy, an abscess, a clot, or some type of, you know, malfunctioning area, a bleed. My part as the nurse in interventional radiology, I sedate patients for these procedures. So when I say sedate, I use a combination of drugs. It can be between 2, or really it can be between 1 and maybe 3 or 4 drugs that I use to sedate these patients, to allow them to be calm during their procedure. So it's not necessarily that I'm anesthesia. I'm giving them medications that work in conjunction with each other to relax them and keep them calm and help them be pain-free during the procedure, so that way we can actually do the intervention without having to use anesthesia. So it's a little cheaper of an option to actually be able to do the procedure. A lot of times patients come in, they're anxious, and just using numbing medication doesn't necessarily work. So in order for them to be able to be still for a couple of minutes on the table, we have to be able to get them to relax and be calm. So that is my part as a nurse in interventional radiology. So I play a very critical part in making sure that patients are healthy enough to be able to tolerate the medicine, to make sure that the patients can withstand the procedure, and then I'm also in the room making sure that the patient is 100% safe while I'm pushing the medicines and the doctor is doing the procedure. So what are your requirements to get into interventional radiology? So most places, and I've had a couple of people on like social media, like Instagram, ask me like, what are the requirements? What do I need to do? How do I get into interventional radiology? So in order for you to get into interventional radiology, and this is usually the requirement that I tell everybody, like it's my general answer for everybody. Most places want you to have some type of critical care department experience. So that means like ER, ICU, some type of critical care experience. Now, with me, I honestly, I was lucky to even be put into this type of position. So I worked on a telemetry step down unit where I would sometimes have to float to the ICU. So in a way, I still kind of got my ICU experience by having to float, but I was also getting patients that were coming directly out of an ICU. So I was still having to like titrate drips to a certain extent. So I still kind of got that critical care experience, because usually when patients come out of the unit, there's a big chance that they can always go back to the unit if they're not ready. So it was still a high functioning floor, and just having to deal with, you know, that type of care for the patients. So I always tell people when they ask me this question, I would reach out to the manager and see what they will be willing to take. You can always be trained to do this type of job. So I always tell them to reach out to the manager at the Interventional Radiology department, especially if you've already got some nursing experience behind you. But if you are a new grad nurse and you know that interventional radiology is something that you might be interested in the long run, definitely start in some type of critical care experience. I didn't be confused about what are the requirements, because I was blessed to be into this type of position. So critical care is usually the biggest thing that they look for, ED, ICU. So if you want to get into interventional radiology, that is the route that I would tell you to get into. But if you already have experience, just reach out to the manager and see exactly what they will take, because you can always be trained on this type of stuff. Because I was trained, because I never really sedated anybody like this before. But she asked me, she was like, are you comfortable with doing it? And I was like, yeah girl, I'm comfortable, come on, bring it on. So if you are comfortable with doing it, just express that to the manager, and you can definitely work something out and try to figure out your next steps to get into the department. Another question that I had was, what is a typical day for an interventional radiology nurse? So for me as a traveler, because I'm currently traveling, it varies based off of what the department needs are. For my current assignment now that I have, I usually go in at about 7:30 in the morning, and I'm usually off about 6. Now, with interventional radiology, there is a variety of different departments that you could be floated to under this one department. There's CT, there's MRI, there's special procedures, which is usually the biggest department that's going to require the sedation. There's I think I said ultrasound, I'm pretty sure I said CAT scan, special procedures, but it just depends on each department. Like I said, there were different departments that I would get floated to that I'd never been floated to, like the breast center. I would have to do breast center workups for patients who were getting mammograms. It honestly just depends on what the hospital requirements are for their radiology department. But the biggest and main area that you're going to be in is going to be your special procedures and CT scan. Like, that has been universal everywhere. Now, there are also times where you may have to do like a pre-op and a post-op area for patients. So sometimes you may be in a department where you're just working up patients and recovering the patients. Back 3 years ago, when I started my home hospital interventional radiology, my hours varied. I would either come in at 7, I would come in at 6, and I'd be off by 7, or I'd be off by 4:30. So my days would flip in and out based off of the availability of the department. So it just depends. So typically, for most radiology areas, you are assigned to a certain area, and that nurse will do all the procedures that are assigned for that area, and they will usually just sedate for all of those procedures that day. They'll usually pick the patient up from the pre-op area, take them over to the procedural area, sedate them, get the procedure done, and then bring them back to the recovery area based off of how it flows. And then there are times where I have been the workup nurse, the procedural nurse, and the recovery nurse, and just saw the patient through the whole process. If y'all haven't really picked up on it just yet, like, it is it can go either way. It is a very versatile type of specialty. Okay, so we're gonna talk about the drugs real quick. So the reason why you have to have the critical care experience is because you're gonna be using at least two different types of medications that are going to be putting a patient in what we call a twilight sleep. So we're going to be using fentanyl, and we're going to be using Versed, and these medications together work in conjunction to give a patient what we call a twilight sleep, to kind of help them relax and make sure that they're comfortable while they get the procedure done. So imagine being wide awake, and a doctor goes in with some numbing medication and goes in with the catheter and this big old long needle and snaps a piece of your tissue. You're gonna feel every little bit of that. So why we sedate is because we try to make sure that the patients are comfortable, they don't feel the pain. Of course, we do numb up the site just to give them an extra boost of just numbing. But a lot of times these patients, they on higher drugs than that. Critical care training is going to be very big when it comes to applying for a job. So that is going to be it for this video, y'all. I want to try to keep it very short, very straightforward, just let y'all know the basis of everything. But if there's something that I did not answer, I did not put in this video, please comment it down below and I will absolutely get back to you with the answer. Or if it seems like it's going to be a good video idea, I will make a video about it. Hit the like button if you enjoyed the video, and if you are old to my channel and still tuning in, thank you so much. I appreciate y'all and I cannot wait. And let me know if y'all are applying for travel jobs. Let me know like what I can do, like travel tips, or if y'all are applying for interventional radiology job interviews, like let me know what I can do to like help y'all spice up your resumes or whatever. And I will see y'all in the next video. So peace out, lifesavers. Bye.